Retiring before 65, here is how to afford health insurance. The number that stops most early retirements cold, and how to beat it. You have done the math. You have saved diligently, maybe paid off the house, built multiple income streams. By every financial measure, you could retire at 60, at 58, maybe younger, and then you get the number that stops everything cold. Health insurance before Medicare costs how much? A 62. Year. Old without employer coverage and without subsidies can face marketplace premiums exceeding $1,200 per month. A couple in their early 60s can see combined premiums of $2,500 to $3,000 before deductibles, before copays, before a single prescription. This number alone has delayed retirement for millions of Americans by 3, 5, or even 10 years. But here is what almost nobody tells you. Most people who retire early and navigate this correctly pay a fraction of that sticker price. The system has levers, specific, legal, powerful levers, that dramatically reduce what you actually pay. The people who know about those levers retire early. The people who do not get hit with bills they never anticipated. And in 2026, the landscape changed dramatically. The enhanced subsidies that protected early retirees for 5 years have expired. The subsidy cliff is back. The strategies that worked in 2024 and 2025 require adjustment. This guide tells you exactly what changed and exactly what to do about it. Stay with this to the end, because the section on income management is the piece of information that changes the entire calculation for most pre-Medicare retirees. The gap why age 65 defines everything. Medicare does not begin for most people until age 65. Social Security can start at 62, but Medicare is 65. Full stop. This creates the coverage gap, the period between leaving employer insurance and Medicare eligibility. For someone retiring at 60, that gap is 5 years. At 55, it is a decade. During every month of that gap, you need health coverage. The financial risk of going uninsured is catastrophic. A single hospitalization without insurance can cost more than $50,000. The question is not whether you need coverage. The question is how to structure your retirement finances so that coverage is affordable rather than financially ruinous. There are 5 primary options for bridging this gap. Understanding all 5, and knowing which combination works for your situation, is the foundation of every successful early retirement health plan. Option 1, the ACA Marketplace, the most powerful tool. Used correctly, the ACA Marketplace is the option most early retirees will use. It is also the most misunderstood. The cost is tied to your income, not your assets or net worth. If you can keep your taxable income relatively low on paper, your insurance can be heavily subsidized, even if you have significant wealth sitting in retirement accounts. A retiree with $1.5 million in a Roth IRA generating 0 taxable income for the year can qualify for substantial subsidies. The subsidy calculation looks at your modified adjusted gross income, not the size of your portfolio. This single insight changes everything. The 2026 subsidy cliff, the most dangerous rule change in 5 years, the enhanced subsidies that expanded ACA affordability from 2021 through 2025, officially expired on the 31st of December 2025. The subsidy cliff is back. If your modified adjusted gross income is even $1 over 400% of the federal poverty level, you lose 100% of your premium tax credits. For the entire year, the critical 2026 thresholds, $63,840 for a single person and $86,560 for a couple. $1 above either number eliminates your entire subsidy. The consequence for a single person, a premium that was $200 per month could instantly become $1,200 per month. A 64-year-old near Medicare eligibility could see annual costs triple from $5,328 to $16,500. Nearly $1,000 more per month. This is not a minor technicality, it is a $12,000 per year consequence for getting your income wrong by a small margin. Managing your MAGI and staying below the cliff is the single most important financial task for early retirees using the ACA Marketplace. Option 2. COBRA. The strategic bridge, COBRA, allows you to continue your employer's health plan for up to 18 months after leaving employment. You pay the full premium your employer was paying on your behalf, plus a 2% administrative fee, typically $600 to $800 per month for an individual, or $1,500 to $2,000 for a family. Expensive, but it preserves your existing doctors and prescriptions with zero disruption. The strategic value most people miss. COBRA is retroactive for 60 days. If you retire in good health, you can wait 59 days before electing it, paying nothing unless you actually get sick. If you stay healthy during those 59 days, skip COBRA and enroll in an ACA plan within your special enrollment period. If you experience a health event, retroactively elect COBRA, and it covers you as if you had enrolled from day one. This 60-day retroactive window means you can carry the option of COBRA as insurance against health surprises without paying premiums for coverage you may not need. Losing employer coverage also gives you a special enrollment period, a window from 60 days before to 60 days after your coverage end date, to enroll in a marketplace plan outside of open enrollment. Option 3. Spouse's employer coverage, the simplest solution if your spouse is still working and their employer offers dependent coverage. Joining their plan is typically the most affordable option available. Employer contributions typically subsidize the cost significantly, making it dramatically cheaper than any individual market alternative. The limitation is straightforward. This only works as long as your spouse remains employed with benefits. It creates a health insurance dependency that may constrain your spouse's own retirement timing. For couples planning early retirement together, this is a coordination conversation that must happen explicitly and early. Option 4. Medicaid. More people qualify than expect in states that have expanded Medicaid under the ACA. Eligibility for adults under 65 is based entirely on income, not assets. A retiree with $2 million in a Roth IRA generating zero taxable income can qualify for Medicaid in an expansion state. This surprises most people, but it is how the law is written. For early retirees who can structure their income below the Medicaid threshold, approximately $22,000 for a single person in 2026, this represents essentially free coverage. The trade-offs are real: narrower provider networks, administrative complexity, and fewer specialist options than marketplace plans. A critical 2026 update: starting in 2027, Medicaid expansion enrollees will face a work requirement due to legislation enacted in 2025. Unless they qualify for an exemption, enrollees must spend at least 80 hours per month in community engagement activities. A fully retired person generating low income may lose Medicaid eligibility when this takes effect, making it essential to plan beyond the immediate coverage year. The income management strategy, how to control what you pay, this is the section that changes everything. The ACA subsidy system creates a powerful financial incentive to manage your taxable income, and the tools to do so are entirely legal, widely used, and available to most early retirees who plan ahead. Your MAGI for subsidy purposes includes employment income, capital gains, investment income, pension income, rental income, and Social Security. What it does not include, and this is the key, is Roth IRA distributions, HELOC draws, or return of principal from after-tax accounts. Roth IRA distributions are invisible to the ACA subsidy calculation. A retiree who built substantial Roth assets or who executed Roth conversions in the years before retirement can fund their lifestyle through tax-free Roth withdrawals without generating the MAGI that would eliminate their subsidies. This is the most powerful single strategy available to early retirees managing ACAs. Additional strategies for controlling MAGI: sell taxable brokerage holdings with high cost basis where capital gains are minimal, use HELOC funds for living expenses rather than taking IRA distributions, contribute to an HSA if you choose an HSA-eligible marketplace plan, which directly reduces MAGI while building a tax-advantaged medical fund. The HSA opportunity in 2026: choosing a high-deductible health plan on the ACA marketplace and contributing the annual maximum to an HSA simultaneously reduces your MAGI and builds a medical expense reserve that grows tax-free. For a retiree managing income near the subsidy threshold, an HSA contribution can be the specific dollar amount that keeps them below the cliff, versus above it with the $12,000 per year consequence. The 2026 numbers: you cannot ignore premium payments for marketplace enrollees receiving tax credits more than doubled from 2025 to 2026 after the enhanced subsidies expired, from an average of $888 per month to $1,904 per month. Across 312 ACA insurers, the median premium increase for 2026 was 18%, driven by rising healthcare costs, GLP-1 drug utilization, and the subsidy expiration. The difference between a managed early retirement health strategy and an unmanaged one can exceed $15,000 per year for a single retiree and $25,000 per year for a couple. Over a 5-year coverage gap, that is a 6-figure difference in total retirement costs. A difference that determines whether many early retirements are financially sustainable. The open enrollment window is the 1st of November through the 15th of January each year. If you miss it and do not have a qualifying life event, you are locked out of marketplace coverage until the following year. Retiring mid-year triggers a special enrollment period. But the clock starts running immediately. Mark these dates. Your pre-retirement action checklist first. Calculate your projected retirement MAGI from all taxable sources. This is the most important number in your entire health insurance plan. More important than your account balances, your savings rate, or your withdrawal strategy. Second, compare that number to the 2026 ACA subsidy thresholds for your household size. If you are above $63,840 as a single person or $86,560 as a couple, develop an income reduction strategy before you retire, not after. Third, get the exact COBRA premium from your HR department before your last day of work. Compare it to a marketplace estimate at your projected income level. Model the 59-day retroactive election strategy as your contingency. Fourth, if your projected income in early retirement is very low, check whether your state has expanded Medicaid and whether you qualify. Factor in the 2027 work requirement if you plan to rely on Medicaid for multiple years. Fifth, consult a financial planner who specifically understands ACA, aware retirement income planning, not just general retirement planning. The interaction between Roth conversions, Massachusetts, GI, and ACA subsidies is nuanced enough that a mistake costs thousands per year, and a well-designed strategy saves tens of thousands. The bottom line: early retirement before 65 is achievable for millions of Americans. The health insurance gap is real. The 2026 changes are significant. The sticker price will scare you, but the actual price, managed with the right strategy, will not. The people who retire early on their own timeline are not the ones with the most money. They are the ones who understood the levers, pulled them deliberately, and refused to let a system they did not understand delay a retirement they had already earned. Know the cliff, manage your MAGI, build your Roth. Retire when you are ready.